Hey, everybody, and welcome to the Dr. Mom Show. It's Dr. D, mom of three, and I'm so excited because I have a super duper special guest today. Her name is Hana. It just
Hi
sounds good when
everyone.
I sing it. So, Hana is an amazing person. I've probably known Hana now for what, like 2 years,
My son's my
approximately?
son's 4, so I'm pretty sure like
Maybe
4-ish.
Okay, oh gosh, I can't realize it's been so long. But she's got some cute kids. She has two kids, a little boy and a little girl, and they're so adorable. Um, but Hannah is joining me today because it is National Athletic Training Month, and Hannah is she's a national renowned athletic trainer. So we really just want to give credit out there because I myself personally, I know, teams, all these teams have coaches, and I feel that the coaches always get all the credit, but you always have to remember there's people behind the scenes who are working with these men and women who are super athletic. So maybe Hannah can give us some tips about how to become more athletic, and then also just being safe on the field and whatever we're doing or on the court, and some things that she does because it can always help us out. Before we get into our interview, though, don't forget to check us out every Tuesday. We're on Facebook, 8 p.m. Eastern Standard Time, the Dr. Mom Show. And I put that on Facebook, and you all also check me out on YouTube. And then don't forget, the show also runs on Roku, AWEN, channel 49 on Roku again. And that's Mondays at 9 a.m. And usually it's a different show because that one's like all fancy and produced. So I look like way cuter on that show. My hair is all done. But you can check it out. Also, today I'm going to give a little tip, a little bit more information. I know there's a lot going on about the coronavirus or COVID-19 that's been going on. So you also get some tips at the end of the show to keep yourself and your family safe. So everybody give it up for Hana. Woo!
Hi everyone.
All right. So before we get started, don't forget that the Dr. Mom Show is a medical informational resource. It does not take the place of your physician or your child's physician. So definitely get your medical advice from them. This is just to help you so you are more informed. So I'm going to have Hana introduce herself and tell us a little bit about what she does and what it is to be an athletic trainer.
So yes, my name is Hana. I am originally from Georgia. I am married to an active duty soldier, and we have two beautiful kids together. I became an athletic trainer in 2013 after graduating from Georgia Southern University. I began my career with Optum Orthopedics, and I was placed out at Portal Middle High School. Go Panthers! So after about 5 years, my husband was stationed in Texas, so we moved to Texas. I worked a short time with the hospital Baylor Scott and White, and I am currently employed with Potomac Healthcare Solutions as a contractor with the U.S. Army, and I am working with them as an athletic trainer. Actually, my 1 year anniversary is coming up next month.
And before Hannah continues and she gives us her tips, just so you know, the employer of Hannah, this is no reflection of their views. This is just information that Hannah is giving us personally as an athletic trainer. So again, this is no reflection in regards to how her employer views things or things like that. This is completely something separate. So, all right, Hannah. So what do you think is the best thing about being a athletic trainer?
So, in my opinion, the best thing about being an athletic trainer is getting to love so many different people and to wear so many hats, and to be able to do so many different things for all the different athletes. We are actually not just in the second, like the high school or the youth sports. We are in the military setting, the public safety setting, the occupational setting, performing arts. You can find us in physical therapy clinics. So we have a wide variety and a pretty wide scope. So the best thing is that there's not just one thing that we could do. Our options are unlimited, actually. So for me, I currently work in the military setting, but I actually do miss the high school setting. I love being on the sidelines on Friday nights, um, under being a part of a team, being a part of every win, every loss. So that's the most the luckiest thing for me as an athletic trainer.
So tell us on a typical day that you go to work as an athletic trainer, what does your day look like typically?
Currently, right now with the military, I wake up and I go to PT with the soldiers. I run a PT session with the soldiers who are hurt physically. So usually they are not able to run, or they are not able to run for a long time. So I run a cardio clinic. It's for them to get the cardiovascular exercise without having to go out and run. So we do it with the bike, rower, or treadmill. We have a elliptical as well. Um, the cardiovascular exercise is not limited to machines. So we also have different exercises that we do. After that, I run a sick call. So soldiers who need to come in and be evaluated for any type of musculoskeletal issue, they come in and I evaluate them. And I spend the majority of the rest of the day doing physical therapy, basically, with patients so that they can return back to work.
So how awesome is that? Hana is helping the men and the women who put their lives on the line for us, to protect our country. So think of that. Like we always, and I definitely am all about giving people who are in the military um, credit for what they do, because it's scary. It's scary out there. They never know where they're going to be placed. They never know really much until you're like retired, right? Then you know, right? You're married to a military
Yes.
guy. So there's a lot of uncertainty there. So you have to really give these men and women a lot of credit. But then there's people like Hana. Even though Hana isn't like active military, she's helping these people to be at their best performance and have their best body, their be in the best shape in order to fight for us and protect our country. So that's pretty awesome. I give you so much credit, Hana. Thank you for doing that.
Thank you.
So now what would you say is the hardest thing about being an athletic trainer?
I think for most athletic trainers, we become so emotionally invested into our athletes, into our patients, into our soldiers. So it's hard to see someone who wants to do something so bad, but they're limited because of their injury or their illness. So not being able to fix someone immediately, or just do whatever they need to do to get where they need to get at the time that they want to get there is probably the hardest thing. I know my last football game with the high school that I was with back in Georgia, I had an athlete go down on the field. That was the craziest game that I've ever worked. Had one, I was in the ambulance with one, and then they called me with another. So the ambulance had to leave. We
Oh
had to
my
leave one
goodness.
patient, make
These high
sure that
schoolers
patient
are
we had to make sure that patient was stable. She was having an asthma attack. Then
oh
we had one
man.
who had a tip fib fracture on the field. So we ended up having to call the chopper. The chopper had to land on the 50-yard line to get this athlete. And it was one of the ones who I met when I first got there. And when I first got there, he said, "Miss Hana, I love you because you make us feel like we're a family."
Oh.
So he was one that pulled my heart whenever looked on the ground and saw it was him. But seeing that, it was emotional for me, and having to see him go down, and then but being there with him from that point until the time that he was able to walk again, it's just it leaves us speechless, and
Yeah.
that's what we're here for.
Yeah, that's awesome. And just for you guys out there, a tib fib fracture, that's the tibia and the fibia. Those are our big bones in our legs. So that's why Hana was talking about like he couldn't walk and they helped him rehab so he could walk again. So imagine how amazing and how important, what an important role Hana is playing. Because I know as a mom, like, yeah, I'd be loving Hana if, my child went through something like that and then could walk again. That's something very big. Well, good. Well, Hannah, in the sports field, one of the hottest topics is concussions. Do you see a lot of that with what you do?
At currently, no, I do not. I think the Army has a pretty good concussion facility, the TBI facility that they have. So I think they put a lot of research and money into making sure that those facilities are equipped and furnished for the soldiers. But in the high school setting, yes, definitely. And I think it's very important to continue to educate, because a lot of the students don't realize how serious concussions are. And I think we don't need to stop at the students. We need to get the parents as well, because a lot of the parents are still with the old ways of, oh, I just got my bell rung, I can just get up and continue going. And that is absolutely false. Concussions are definitely traumatic brain injuries. They might be mild, but they're still brain injuries, and they could potentially be life changing.
Yeah, and Hannah mentioned, so TBI is traumatic brain injuries, and I'm sure you guys have heard.
Sorry.
Oh, that's okay. She got all these fancy terms. I'm just filling you all in on Hannah. It's okay, Hannah. We get so used to saying that, and you're around people who understand it, that it's like second nature to us. But it is so important. I agree, because I get patients in, who I see who have had concussions, athletes. Sometimes you have kids who even just fall from a bed, they're playing around, fall off their bike, fall off a, skateboard, and get a concussion. And I totally agree with Hannah that kids, for sure, some kids don't really realize the extent. Like, we have restrictions. Like, if you're a football player and we feel you had a concussion, you're not supposed to just go back into the game. You're supposed to have time off, make sure that your symptoms have all resolved. So things like vomiting, headache, any dizziness, nausea, like if you feel like you're going to vomit, or if you're vomiting. And I know that's been tricky, because even in the national sports arena, there's been a lot of talk about that too, when players, and these are like star athletes, if something happens, people want them to play because they're such key players, but sometimes they can't. So I agree. So parents, if you're watching, definitely pay attention to what the doctor says. Hannah's making a face. Can you not hear me? I think Hannah's having some
Yeah, you're start.
oh, there she goes. We're having some issues. Hana is another part of the world, so I was making fun of her. Let's see if she'll come back on here. This internet, it's so
Okay, I think
okay,
that's
you got
good.
it? Okay. All right.
I can't see you, but I
Okay.
can hear you
All
better.
right. I can hear you. You can hear me? Oh, I think I lost her. Can you hear me? No, Hannah can't hear me.
I can hear you.
Oh, there we go. Okay,
I
so
can.
definitely
I can hear
remembering.
you.
Okay,
Yeah.
definitely remembering about the concussion. Um, so what would be 3 safety tips that you would give our viewers out there about playing sports, things to do before you play, during play, or after?
I think number one is to stay hydrated, especially in the summertime. Not just the summertime, because hydration is important year round, but when in the hotter months, hydration is key. Not just hydrating, making sure you eat appropriately, fuel your body, because your body needs to it needs fuel for what you're getting ready to put it through. And once you get done putting it through the exercises, the physical activity, the physical exertion, then to replenish, continue to drink water, make sure you replenish the fuels that you need. That would be my number one. My number two would be to effectively warm up and then cool down after. You have to prepare your body, just like you prepare your body um, through hydration and fueling. You need to prepare your body for the exercises that you're getting ready to put it through. So warming up, and there is no really set time. Research doesn't really say that there's a prescription for the amount of time that you should warm up. Everyone is different. They do say that you should not warm up too far in advance before you exercise, because you give your body time to cool down, and then you have
Like
to warm up again.
warming up in the morning
But
and like working out at noon.
right, so yeah, warm up before, allow your body to practice, play a game, whatever you're have on a schedule for that day, and then once you get done, cool down. You have to allow your body to come back down to neutral, to baseline. And then number 3 is to pay attention to your body. Your body will let you know when something's not right. If something is not right, you should definitely seek help. If you're hurting, don't ignore it. We as athletic trainers, we'd rather know that you're hurting whenever you're hurting, and not 2-3 weeks down the road whenever it's not getting any better and you're just like, oh, I thought it was going to get better, but it doesn't. That's when we like to hit it when it starts, and it's just better for you and better for us, because if we get it when it starts, instead of 2 or 3 weeks down the road, and to where we have to pull you from play or from practice, and that makes the athletes unhappy. It's just better for all of us, for us to communicate, and for you to let us know that something, I think I twisted my ankle, or I think I pulled a hamstring, or my back has been hurting after I lifted some weights. So it's just trusting your athletic trainer and communicating with them, beneficial for both of us.
Awesome. Love those tips. I love them, love them, love them. And just to piggyback on Hana's tips, hydration is super important. We get athletes, especially in the summer, if guys and girls are going to camps, and they end up getting muscle breakdown, and they get so severe muscle cramps. Sometimes their kidney numbers are all out of whack because they're so dehydrated, and they have to be admitted for us to push IV fluid. So listen to Hana. Tip 1, hydrate. The second one, stretching and cooling down. Definitely agree with that, because your muscles every day, even if you're not necessarily working out or playing every day, you should stretch every day, because then if all of a sudden you go outside and play, or you play a game and you haven't stretched, that's when you can pull something, you can strain something. And then of course, number 3, like she said, listen to your body. I always say that. Even if somebody who I see gets hurt, I tell them never to take Tylenol or ibuprofen before they play, because that's going to mask your pain. And I totally agree with Hana that you have to, if you feel something's hurting, tell your therapist, tell your trainer that it's hurting. Don't like push through, because that strain or that pull can become a tear. You can tear a muscle, tear a ligament, break something. So you definitely want to listen. Well, this was awesome. I'm so excited. I'm also excited because Hana, definitely stay posted, because there's a book collaboration that's going on. And Hana is a part of the book collaboration. I'm so excited. Can't give too much information, because later this month is when everything's going to kind of be unveiled, to introduce all those people who are part of that amazing project. And I'm so excited, because Hana is one of those amazing people who's a part of it. So Hana, I just want to say thank you so much. My last question for you is, if anybody out there is interested in becoming an athletic trainer, is there like a website or a resource that they can go to find out like what they need to do for school or things like that?
Definitely. The National Athletic Training Association has a website, nata.org. Has all kind of information. It has the information that you would need to pursue this career. Has information on concussion, sickle cell trait, asthma, any type of information that an athlete or someone who wants to pursue this profession would need. Everything is on there.
Awesome. Well, and then of course, if you have any questions about either anything about training, exercising, stretching, definitely feel free to post your questions, and I can always get them to Hana for her to answer more specifically. Don't forget to wash your hands, kiss your kids, love your family, and say your prayers good night. And to end out with our COVID-19. So this coronavirus is going crazy. Unfortunately now they're having more and more cases. Some cases they don't even know where the origin is from. They can't track it. But to give you a couple of tips, biggest thing is hand hygiene. Please, please, please make sure you wash your hands. Well, make sure you wash your hands well. What you drinking, Hana?
Lemon ginger tea.
Ooh, that's good. That's good for your body. That's a cleanser. So, definitely wash your hands. And washing hands is just putting it under the water and washing it with some soap. Washing your hands is getting your hands wet, getting some soap in there, rubbing your hands. Make sure you're rubbing the back of your hands, both hands, in between your fingers, under your nails. No matter how short your nails are, no matter how clean you are, germs and dirt still get under your nails. And usually it's approximately 20 to 30 seconds we say to scrub your hands with soap. So you can either sing happy birthday, the happy birthday song, happy birthday to you, not that fast. You sing that twice, or you can sing the alphabet song, ABCD, that song once. And then of course dry your hands first, and then use your paper towel or your towel to turn your faucet off. Other important things is, of course, if you like sneeze, blow your nose, cough, things like that, try to wash your hands. And if you're someplace, I always try to use my knuckle. Like if I'm on an elevator, I push it with my knuckle. And now everything's computerized. If you're at the grocery store, like I push it with my knuckles. That's something else. Walking around with hand sanitizer. So please, 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 good hand hygiene. And of course, if you are sick, definitely don't go around everywhere. That's something that I find to be very frustrating. There's kids out there, there's other people out there, there's pregnant people out there, and you shouldn't just walk around if you know you're sick, whether it's with the flu or anything else. So definitely be diligent and mindful, and considerate if you are sick. So definitely stay safe, you guys. Again, I love you. Give a hand for my special guest, Hana. I'm sure we'll have her back again to talk about some other stuff because, I'm sure there's other months that have to do with let's exercise and stretch more. And then Hana can even maybe show us some moves of how we can stretch. So that'll be awesome. And then if you have any questions, let us know. You guys take care, and bye for now from Dr. Mom. We'll see ya. Bye-bye.
Bye.